For more on this national crisis, let's welcome in Dr. James Besante, an addiction medicine specialist. Doctor, thank you so much for giving us some of your time. So we just heard Sloan's report there. Given the drug's strength, are you surprised that there's now this ripple effect of some morgues and funeral homes just being overwhelmed?
Not at all. I can tell you this is a trend that's been seen nationally. I'm happy to see that it's garnering national attention, but the overdose crisis is continuing, it's worsening, and we need to bring attention to this. I will say that, when I see morgues overcrowded with bodies related to overdoses, I think this is also a case of stretched public infrastructure. We're overextending our public institutions. This happened during COVID as well. That medical examiner also identified operational issues like staffing problems in the morgue and the population growing in the county. So it's multifactorial, definitely, but I think it's a great opportunity to highlight overdose deaths, definitely.
Absolutely. And Doctor, just talk about how you've seen the impact of fentanyl cases and the subsequent issues related to fentanyl change over just the past few years.
Yeah, I can tell you the first time I saw a patient overdose on fentanyl, I was working in Boston in an emergency department, and we could not figure out how the patient got fentanyl. It was unknown to us. This was about 6-7 years ago. It was uncommon then. And then quickly, we saw a dramatic increase in fentanyl overdoses that spread across the country. Now I tell all my patients that fentanyl is essentially ubiquitous in the heroin supply. It's becoming less common, increasingly uncommon, really, that I see patients using heroin. Almost all of my patients are using fentanyl entirely without even heroin present in what they believe is heroin. And then the other thing I'll highlight is that fentanyl is adulterating many drug supplies. The majority of prescription pills sold on the street in many communities are actually fake press pills that contain fentanyl. So I think it's spread across our country in the heroin supply and now found its way into many other drug supplies.
Well, Dr. Besante, in Sloan's piece there, we heard from Dr. Khan. He mentioned these test strips. You mentioned how these other drugs are laced with fentanyl. We know it's making its way across our borders. What do you see as the answer to stopping people from using it? Because in so many cases, they're unknowingly using it.
Yeah, that's another great question. So fentanyl test strips are important. Many states recently have taken huge steps in increasing access to important harm reduction supplies like fentanyl strips. But I will say this, I tell all my patients to expect fentanyl to be in certain drug supplies. I don't even think it's worth checking heroin nowadays to see if there's fentanyl in it. It should be assumed that fentanyl is in heroin. Now, it's different when you think about other drug supplies like stimulants, methamphetamines, cocaine, pills that people believe have been purchased from a pharmacy. There, I think there's real utility in using fentanyl strips. Other important harm reduction measures like overdose reversal drugs, Narcan, have to be expanded as well. And let's not lose sight of treatment. Okay, most patients in the United States of America do not have access to treatment. 90% of patients with an opioid use disorder are not being given access to medications like buprenorphine, methadone. These drugs reduce the risk of overdose by about 75%. Life-saving medications far too few people have access to.
Absolutely, yeah, and it's a crisis that just seems to get worse. Dr. James Besante, thank you so much for your time.
Thank you for having me.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.